Hi, and welcome to this episode of Little Sprout Speech TV. Grab your pen and paper because today Lily and I are bringing you some tips based on a question that Bonnie asked about her daughter, who's 3, that just received a diagnosis of childhood apraxia of speech. So what is apraxia? Well, I'll link to an article below so we don't have to talk about all of that right now. What I want to do is just give 3 tips on what she can do because her daughter is very frustrated. She's been in speech therapy for a year already, and at 3 she's basically using hitting, kicking, and biting to communicate. So what can we do to help? Well, Bonnie, tip number 1 is I want you to use a whole communication approach. What does that mean? That means I want you to continue to work on verbal speech and the sounds that she needs to make, but I also want you to use pictures and sign. So I want you to talk to the speech therapist about using some basic signs, just maybe 2, 3, 4, 5 signs, nothing major right now, just to get started, like more and my turn and help, things like that, open, things that she can use to get a lot of things accomplished. And then I also want the therapist to help you make some pictures for everyday items that she requests a lot, things that she needs a lot that might help to decrease her frustrations. That's tip number 1. Tip number 2, I want you to use social stories because even though she's using the hitting, kicking, and biting as a form of communication, that's not necessarily how we want her to communicate. We understand that is her primary means right now, but obviously that hurts and we don't want her doing that to her friends. So I want you to use those social stories, and I'll link some below for you, because they're for all children who struggle to communicate, and it teaches them what they can do with their hands and their feet and their mouth. So that's tip number 2. Tip number 3 is I want you to find or ask your speech pathologist that you're working with if they're trained in prompt, and I will link that below so you can read more about prompt. I am trained in prompt, and I have found that along with these other strategies, a combination, has been very helpful in helping the little ones with apraxia learn how to speak. So let's review. Tip number 1 is to use a whole communication approach. It can involve even more things than I spoke about today, but I mentioned using pictures and signs and, continuing to work on verbal communication. Tip number 2 was to use social stories. And tip number 3 is to ask your speech pathologist if she's prompt trained or see if you can find somebody who is. That would help. I hope this helps. I look forward to talking to you guys next week. Lily's teething and she's done talking. She says bye-bye. Talk to you guys soon. Bye.